Cause for concern. The infection rate in Nelson Mandela Bay is currently higher than it was during the July peak. Mkhize visited a second time this month. He checked on bed capacity and compliance levels and held talks about the summer initiation season, which is still suspended. Outreach and awareness campaigns were conducted.
The issue comes back to the shortage of staff. But the shortage of staff is not more of nurses, although those need to be added, and doctors. But there's been a chronic shortage of porters and cleaners and general workers. So just to illustrate what tends to happen, if there is a bed in the ward where the patients are supposed to be sent to, then of course you need someone to clean up that place. So because of the shortage, that's part of the delay. The second one is if you have a shortage of porters, movement of people, patients from one area to the other is delayed. So that's really what has caused the challenge. But because of the increasing numbers, it really created a sense of a crisis of hospitals which are full.
Observation wards were identified as bottlenecks in the system. Patients have to wait there while awaiting test results. There was an appeal for better management to get patients to beds, among others, at Livingstone Hospital.
We managed to put in 73 beds, and all those beds are fixed with oxygen. Fixed with oxygen, they are on standby, not necessarily that it is not functional. It is fully functional, but we still don't have patients that have filled our beds. It is unfortunate that we are not differentiating between private beds and public beds. In terms of public beds, we've got space that is waiting. We still have VW, we still have Doranginza, we still have this one, we also have Empilo, and all those spaces are waiting for patients. So the sense of saying everywhere it's full, for public hospital, it's not true.
Although the metro is the hotspot, there's also concern about the rest of the province. Eastern Cape accounts for 43% of new infections in the country.
I would like the minister to at least put some authorities, like maybe an hour, like they must come and check how's the situation with good taverns, you see, and then just to check up on people, because people, they don't follow. As much as we think they will do, but they don't. And it's sad.
Police must be coming in the ground, and they must protect the people, and they must make a strict law about that, because the viruses don't see nobody, and mostly the children are also getting sick and affecting about that. So that is my wish. The government must be concentrated on that.
A decision about the reopening of the initiation season is expected next week. Traditional leaders are adamant that they are ready to host initiates. An estimated 40,000 young men in the Eastern Cape are set to undergo the rite of passage this December. Lerato Fekisi, SABC News, Port Elizabeth.
Lerato has more on that story.
Well, there was this huge expectation that the Minister of Health, Zweli Mkhize, was going to come to the metro and perhaps shut the metro down and implement a really harsh lockdown. This because as people in the metro are concerned about the rapid rise in numbers in the metro. Currently, our stats say the metro is at 5,935 cases that have been reported. That is half of the statistics here in the Eastern Cape. So there was this huge expectation he's going to come to PE and is going to lock the city down. But there are various challenges that the Minister of Health did raise in his 2-day visit to the metro. Number one, he said that the observation wards are causing bottlenecks in the system. He said that the waiting period of patients to get their test results there is 2 to 3 days, and that causes congestion in that specific ward. He also did stress, as much as there is a concern about the lack of doctors and nurses, his bigger concern is the lack of porters and cleaning staff and general workers as well. He then went to talk about the issue of availability of beds. You know, for the real part of this month, people have been saying there just are not enough beds in the metro. He actually watered down this rumor and said that if you go to every single hospital in PE and also in the Eastern Cape, there are sufficient beds. He noted that at Livingstone Hospital and Doranginza Hospital, there were 2 specific areas there that are actually renovated to get more beds in. So there is bed availability, and also there is also the parking lot at Livingstone Hospital, which has been converted into a COVID ward and able to house 75 patients. Then we also have the Dr. Nxiweni Field Hospital that's also able to take more patients that are positive with COVID-19. So he said that despite all the rumors and all the fears, he is very much sure after his interactions with the ministers, the other officials of the health department, there is sufficient beds for people in the Nelson Mandela Bay Metro. Another issue that was a concern, obviously, is the initiation season, which is coming up in December, which is huge for the Eastern Cape. Over 40,000 initiates are expected to enter that entry of initiation school. But he did say that after interacting with the traditional leaders, they are adamant that they have put all measures in place to make sure that this season can carry on in December. We are aware that it actually has been stopped. So the Minister of Health said that after interacting with traditional leaders, he's got a report from them. He will take that now to the National Command Council, and only after he has deliberated with them, he will then come back next week and make a final decision whether the initiation season is going to take place in December or not. So that is still pending. The Minister of Health said also concerned when he went to Motherwell Township, when you walked through the mall, is that how people are not complying to COVID-19 regulations. He said he met various people both inside and outside the mall who were not social distancing, who were not wearing masks, and he said that, you know what, in hospital we save lives, but the fight against COVID-19 can only take place in the communities. So he did say that he had meetings with the municipality, and there's going to be a huge campaign, especially as we go to the hectic festive season, where they're going to go around into every single ward with flyers, with banners, with hailers, educating people about the real issues of COVID-19. He also said he is quite also anxious because there seems to be myths surrounding how you get COVID-19, how to treat it, and he said that education at this time, as numbers in the metro really rise above what was expected, is that education is going to be key. People must know exactly how do I contract it, which hospital can I go to, where can I get help if I am COVID-19 positive, where can I go for testing, etc., etc. Also, what we saw this week was that there's going to be rapid testing. We know that various testing sites have been set up throughout the metro to encourage people to go, and he was saying that he's very much excited that at various testing stations that he did go to, people are coming out in their numbers to get tested. Overall, he said that at this stage he cannot make a decision about whether the metro is going to be on lockdown or not. There is huge speculation going around right now that we're going to go to lockdown level 3, but he said, like any other order, he first has to go to the Command Council, present all the various reports from the various stakeholders, and only after he's presented what he found in the metro will a decision be made about whether we are going to lockdown 3 or not. So it's not yet clear, but he did stress as he ended his briefing with the media before he left that in the end it is all up to the citizens. The citizens must be the one that take full responsibility about their lives. He said we are going towards the festive season. People are going to go out to nightclubs, to taverns, and even in those areas, even when they are having fun, they must make sure they are compliant to COVID-19 regulations. So he said he is happy with the work that's been done. He is aware of the challenges, but above all saying that the numbers in the metro will only go down if citizens play their role by adhering to COVID-19 regulations. So that was a wrap of the metro. That's how our week was, and we wait in anticipation about the announcements of the initiation season, which is expected to come next week from the Minister of Health, Dr. Zweli Mkhize. For now, let's go back to you in studio.